This video is for basic facial, and we start the video as we always would upon arriving to work. So the first thing that we do when we get to work is we wash our hands. So we go to the sink, we wet our hands, we get a coin-sized amount of liquid hand soap, and we wash our hands together down to our wrist. We wash the back of our hands down to our wrist, we wash our fingers, and we wash the back of our fingers. We wash our fingertips and our nails, we wash between our fingers, we wash between our fingers and our thumbs, we wash our thumbs, we wash our wrists, and we do all of that, interlocking, cleanse, and wash for a minimum of 20 to 30 seconds. When we feel like we've gotten everything clean, we do a good proper rinse under the water. When you're thoroughly rinsed, you're going to grab disposable paper towels or a towel to turn the faucet off, dry your hands completely. Paper towels go in the trash. If it's a towel, it's now dirty, and it would go in a closed container until it's time to do the laundry. Then you're going to find your hand sanitizer, 70% ethyl alcohol, and you're going to sanitize your hands thoroughly. And once you do that, you will be able to prepare your room for the basic facial. So what do you need to do? And you always want to do everything you can for every service ahead of time, because you want to be punctual with your clients. They have appointment times. You want to be on time for them. You want to be on time for yourself and your schedule as well. It's just very professional. So you need to do everything you possibly can to prepare before a client arrives. So you're going to disinfect your workstation, bed, and equipment using a disinfectant wipe, following manufacturer's instructions. You'll check equipment to ensure that all devices are in safe working order and plugged into a working receptacle. You're going to gather clean supplies needed for the facial service, store in a clean closed container. You'll turn on your hot cabbie and stock with at least 3 clean wet towels. More may be needed depending on the service and the client's needs. You'll fill a clean steamer glass with distilled water and preheat your steamer. You're going to dispense products needed for the service according to skin type and client's needs as follows. You'll prepare disposable portion cup tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with a disposable portion cup tray, or remove product with a disinfected or clean single-use spatula. Close the lid to the product and set the portion cup tray on the tray. Drape the facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. Place clean laundered sheets down on the disinfected facial bed, placing a towel horizontally at the head of the bed. Lay a hairnet and headband on top of the first towel, along with a rolled towel to support the head and neck of the client. Save the third towel to lay across the client's décolleté. So we've prepared the bed, and we're going to just review our tray of everything that we have prepared for our client. So what we have water, we have 4 squares, which I actually need to get some more of those. We have 2 squares of cotton rounds. We have wooden stick Q-tips. We have cleanser, exfoliant. I just wanted to make sure I had enough 4 squares for the facial. We have makeup remover, astringent, we have disposable scoopers, single-use items, we have a brush to apply our mask, we have eye cream and moisturizer, we have, of course, disposable gloves if we do need to perform extractions. We have everything set up that we need to perform the basic facial. So at this point, what we would do is, because all of our products and extra equipments are set up, we would do our client consultation. Now, you may not be able to do all of your like dispensing of the products because you may not know the client's skin type, etc. So that may have to wait, but at least you can have your tray set up and everything ready to go. So we are going to meet our client, and one thing to note is that I am meeting my client with clean hands, even though I'm going to wash my hands again before service starts. Just note that, of course, my hands are clean when I do go to greet my client. So we will greet our client and escort them to the work area. We're going to determine our client's preferences. And so this time that we spend with our client is extremely important for many reasons. We're going to assess our client's needs, so what their goals are, and we're going to assess the client's skin. Initially, we're only going to be able to just look at it with our eyes while we're talking. to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. We're going to assess the client's consultation form for any medications and products used within the last 72 hours and consult on any known allergies. We will consult with the client on any facial surgeries within the last 3 months and if the client's under a physician's care. So I'm just going to lightly touch on this and then kind of go over a little bit more detail in a minute. We're going to assess if the client is prone to cold sores or fever blisters. We will assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. We'll assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. So before we conclude this, it's really important that you get to know your client extremely well at this point, and if you don't know something, that you look it up. For example, medication that they're on is critical because medications that you take can affect the way that your skin is, be it thinner, more sensitive. There could be a lot of contraindications, so you need to make sure that you know that. If they're allergic to something, you need to know that because you would never want to use a product that has an ingredient that the client might be allergic to. You need to know if they've used things on their skin that can be a little bit more harsh. That's why we mentioned alpha hydroxy acids or beta hydroxy acids, hydroquinone, because those can certainly make the skin extremely sensitive and potentially also thin the skin. And then you would never want to do a facial if they've had Botox, hyaluronic fillers, and absolutely 100%, no question, you would never perform a service on anyone that has an open or visible fever blister. It's super highly contagious. So just keeping all of those things in mind. Luckily for us, our client Sue here has no contraindication, so we are able to go ahead and move forward with this service. So knowing her, she's an existing client, knowing all the things, we would now proceed to let her get comfortable in the facial bed. So we give her some privacy. We have everything laid out for her so she can change into her drape. So you would close the door, give her private time, allow her to disrobe, put her drape on, climb into the facial bed, get under the covers, and then you can come back and knock on the door. And when she gives you permission, you can come back in. And what your job is to do now is to make the client extremely comfortable. So we're just going to put a little extra towel over that bedding just to give her a little comfort and also protect in case there's any kind of water dropping, etc. We have a rolled towel here that we're going to place under her neck for extra support. And then of course we have a little headband here that we're also going to put on to keep the hair out of the face while we perform the service. Sorry, just a little scratchy throat. So moving forward now, we would be able to start the service once we clean our hands. So we will wash our hands at the sink again. We're going to wet our hands, get a coin-sized amount of liquid hand soap, and we're going to wash our hands down to our wrists. Then we're going to wash the back of our hands down to our wrists. We're going to wash the fingers, and we're going to wash the back of our fingers, fingertips and nails, between our fingers. Between our fingers and our thumbs, we'll wash our thumbs, we'll wash our wrists, and we'll do all of that interlocking washing for a minimum of 20 to 30 seconds. And when we feel like if we've gotten a good proper rinse, wash, we can rinse everything under the sink. And then when you're thoroughly rinsed there, you can grab either paper towels that you're going to toss or, a clean towel, turn the faucet off, dry your hands off thoroughly. Paper towels would go in the trash. The towel, if you use the towel, it's now dirty and it would go in a closed container until you do the laundry, and then you're going to grab your hand sanitizer and you are going to sanitize those hands up. 70% ethyl alcohol hand sanitizer, and you're going to make sure you do a really good proper hand sanitizing. And once you're sanitized, you are ready to start your basic facial. So the first thing that we want to do for our client is remove any makeup that they might have on. And some clients, of course, are going to wear more. Some clients are going to wear less. And now we need to clean the face. So we're going to do the first cleanse. And then we're going to go ahead and remove that first cleanse. And then after you do your first cleanse, this is the opportunity that you have to do your professional skin analysis. So what we're going to do is cover up her eyes because we're going to be bringing in a bright light, and we would be telling him or her, our client, that. So we are going to go ahead and put on some cotton rounds, and then I'm going to go on top of that with force grit. I don't have a magnifying lamp, so I'm just going to be pretending that I'm bringing that in and turning it on so it's a super bright light, and I go ahead and give them the heads up that that I'm going to turn that on. So it would either be a woods lamp or a magnifying lamp. And this is the time, the critical piece of the facial, where we get to actually really see in detail what our client's skin actually looks like. So it may reveal some things to us that we did not know upon initial glance, or maybe the client didn't know upon initial glance. It also gives us the proper opportunity to see what the client said their concerns were and really find out if that's what they are. Sometimes they are having things happen with their skin, but they're being caused by reasons they don't even know. So this gives us a chance to kind of look in detail. The other thing is that we're going to be looking for what we can do to improve this service that we have planned to do. Obviously, with their goals and our goals for their skin working together, what we could recommend for future services that may make a big impact, and also extremely important, the products that we would be recommending for their at-home care regimen, because we know that they are at home much more than they are with us. So that's going to be super important as well. And we are going to be able to then really get all the details about their skin that we've really been looking to find, and we need to also notate. So whether it's your software system or a client card system, you want to make sure that you take a minute to jot down everything that you could possibly need to about the skin once the service is over. So I'm going to look for everything. I'm going to look for dehydration, fine lines, hyperpigmentation, blemishes, excess sebum, large pores, small pores, flakiness. I'm going to look for all the things in different areas that we need to check and things that she's talked about. I'm going to look for freckles and moles, because I'm going to be making a notation of that too, because there could be a time when clients coming in for a regular service and we have jotted down what's happening with those moles and freckles, and then we notice a difference, maybe even before the client does. And if that's something that's out of our scope of practice, we can then refer our client on to maybe see their physician, etc., if we're concerned about something on their skin. So all of this is really important. This is not a rush over. This is where you take time and really get in there and look and see what you need to see. So we've done that. We're going to turn off the light, and we're going to take the magnifying lamp out of the way. And at that point in time, you could then also remove eye coverage, because the light's off and it won't be harmful to the client anymore, because when you're in a facial situation, it's nice and dim. It's not like this room right here. So we're going to go ahead and go in with a second cleanse. And the reason we're doing a second cleanse always, once we get under that magnifying lamp, is we're going to see all that residue that we haven't quite gotten from the first cleanse, maybe some makeup still there, or just dirt and debris. And then depending on the client, you may need to do a third cleanse, and today we're going to do all three. I'm going to wipe my hands off so I can remove that second cleanse. now we're going to be going in for the third and final cleanse. And after this cleanse, we are going to follow with a toner. And we will be making sure that we do not come into contact with our little 2x2s with the sprayer. And after you finish that, Tony, we are going to apply our exfoliator. So you're going to always, of course, follow manufacturer's directions. I'm going to get about a pea-sized amount of an exfoliant, and I'm going to spread it out on my client. And of course, we're always going to avoid the eyes, the nose, and the mouth like we do with everything. And then I'm going to massage that exfoliating product in for 1 to 2 minutes. And of course, once you do that, I'm going to read the next steps because I don't have the equipment. We're going to discuss what you would do at this point in the exfoliation process. So you would retrieve that steamer, that facial steamer that we set up with the distilled water during our beginning part. And we will position the steamer next to the facial bed, make sure that it's facing away from the client as the water heats up and emits an even outflow of a mist. Once the steamer is emitting a mist, we'll position the steamer 16 inches over the client's face, aim it at the client's chin for even distribution on the face, and allow the unit to function for 3 to 5 minutes. We will remove the steamer from the client's face, return the steamer to its previous location for disinfection. So basically what we're going to do is we are going to bring the facial steamer, over to the facial bed, turn it on, make sure that it's not facing the client while it heats up. And then that little steam is going to start coming out on an even flow. And then we're going to turn that facial steamer toward the client, let it flow over the client's face for a minimum of 3 to 5 minutes. And then once it's done, we turn it away. Once that time has passed, we turn it away from the client, turn it off, and then put it back where we retrieved it from so that we can disinfect it at a later point after this service is over. And so we're going to imagine that all that time has passed, and then we need to now remove the exfoliant. I also don't have a hot cabbie, so I'm going to take this wet towel from my hot cabbie right here, and I'm going to check the temperature because it's super hot, so I'm always going to check it on myself first. Then I'll also check it on my client. And then I'm going to place the towel on my client's face, keeping the nose exposed so that they can breathe. And I'll let that sit there for a few seconds. In about 20 to 30 seconds, it's going to start to cool down. So just going to apply a little light pressure, let that feel nice on the client's face. And then I'll go ahead and remove the rest of the exfoliant. And one thing to note here is that you're going to follow exfoliation with extraction if they need it. So you really want to make sure you get your hands good and dry, because anytime we perform extractions, you have to be wearing gloves. So I'm drying my hands off before I get my disposable gloves. And my client, thankfully, she doesn't need a lot. She just needs a couple of things extracted. So I'm gonna put my gloves on, and then I'm gonna go ahead and cover up her eyes as if I'm gonna go ahead and pull that lamp back over, because most of the time when you're doing extractions, you're gonna need that magnifying lamp or brighter lamp to really see what you're working with. So let's go ahead and cover her eyes back up for that protection. And of course, I'm telling her every step of the way what I'm doing. Just really want to make sure I give her ample coverage. And then I'll bring the lamp back in and turn it on. Now you can do extractions a couple ways. You can take cotton rounds soaked in astringent and apply them to your fingers, and then you would extract and then work around, extract again and work it around. When you're finished with this cotton round, you toss it, and if you need to get more, you would. I'm going to use the wooden stick Q-tips, so we would use 2 wooden stick Q-tips per one extraction, and then you toss it. So for every time you do perform an extraction, you would throw these guys away. So I'm going to do that. I'm going to soak them in astringent, and she just has a little bit of congestion around her nose, so that's where I'm going to go in and perform my extractions. And the extraction process can be a little bit painful, so you want to make sure that you don't do this longer than 5 to 7 minutes. We don't want the client to be uncomfortable for too long. So every one I'm using, of course, then I'm throwing it right away. She's got one more. So I turn the light off at this point, take it out of the way, and of course we can remove coverage from her eyes. And we're going to toss our disposable gloves as well. And now we're going to follow with the toner. So we have exfoliated, we've extracted, now we're going to tone. So I've got my 2 squares, and I'm going to make sure that my nozzle for my toner does not come into contact. And now the good news is, after that maybe a little bit of discomfort time, she gets to move forward to the massage portion of the facial, which she doesn't have severe acne, so she's someone who does get to enjoy that part. So I'm going to remove some massage product, and most important thing to note here is that you just want to make sure you get enough of the massage product on your hands before you start it, so that you don't have to leave your client to go back into that massage product in order to perform a proper massage that's relaxing. You don't want your hands to be on them and then off them and then on them and off them, etc. So now we just have to remove that exfoliating massage product. Just trying to be gentle because our client might be asleep after her relaxing massage. And then after you take the massage product off, you are going to apply your mask, and I'm going to apply mine with a brush. And just like before, we are going to avoid the eyes, nose, and mouth, follow manufacturer's directions based on the type of mask that you're applying, and of course that will determine the length of time that you leave it on, as well as you're going to go off of the client's skin condition as well. All of those things will be available, information will be available to you based on what the manufacturer says with skin type, etc. So you'll be able to figure all that out ahead of time, and then of course you'll be checking in constantly throughout the facial on your client's comfort level. As always, and this particular mask says to leave it on anywhere from 5 to 10 minutes. So that's of course what we would do. We would leave it on for 5 to 10 minutes, but because we are doing a video, we're going to pretend as if that 5 to 10 minutes based on her skin type has elapsed, so we can go ahead and remove the mask as if it had been on for 5 to 10 minutes. And then we will do our final tone. So of course, keeping the bottle away from those 2x2s, but spraying it on there. And then once you've done that, it's time to apply proper skincare. So for her, it's daytime. I'm going to apply eye cream and moisturizer, of course, with a sunscreen. So for eye cream, you need a very small amount. I'm going to use a teensy bit on to be applied with my ring fingers because they're the most delicate. And I'm just going to tap along the zygomatic arch and the brow bone to apply it very, very lightly. And then I'm going to use her skin feels great. If anything, she is a little bit normal to oily. So I'm going to just use a more of a matte moisturizer daytime that has a great sunscreen in it and a physical, not a chemical block. So it really gets that, blocks the sun, but it also is great for sensitive skin. So I'm going to apply moisturizer everywhere she might need it. Face, of course. Her neck and décolleté might be exposed as well. We have discussed the importance of SPF. She's going to use up something that she has right now, but she's already got a few things that she really knows she needs to add to her home care regimen. So we're going to review that in just a second. And then I'm also going to finish with a little lip balm, because we don't want nice hydrated lips. And then, of course, we would allow her to change back into her regular clothing, give her that privacy to do so, and then she would be coming out to meet us in the client consultation area so that we can then review any maintenance and home care, certainly pull together the products that she's decided that she's going to add to that home care regimen that she really needs, that you know will make a big difference. And then, of course, you've also discussed your recommendations for the next service to be booked, and she's all on board for that. She's so in love with how her skin looks, and she's really committed to that next step with her skincare goals. So you've got her booked, you've got her checked out, you're getting her going home with the right products, and now you've got to get back to your room to prepare for your next appointment, which is also basic facial. So what you're going to do first is you're going to discard any single-use items that you haven't already done, and you will get any implements that are used and dirty and place them in a closed container labeled to be disinfected. All the sheets, towels, and bedding that you've used, you're going to strip the bed and put it in a closed container until time for laundry. And then you are going to identify a proper cleansing agent. You're going to locate that. You're going to read and follow the manufacturer's directions for mixing and usage, and then you're going to completely wipe down your work area station to remove any dirt and debris. Then you'll identify a disinfectant that is bactericidal, virucidal, fungicidal, and EPA approved for use in a salon setting. You'll need to get on a pair of disposable gloves for that because you can't mix that without disposable gloves. And so you're going to read and follow manufacturer's instructions. For mixing and or using appropriate aerosol disinfectant, you will disinfect electrical equipment. You'll store it in a clean area separate from other implements like your steamer. And then to finish it all off, you got to wash your hands. So wet your hands at the sink, get that coin-sized amount of liquid hand soap and wash your hands down to your wrist. You're going to wash the back of your hands down to your wrist. You're going to wash your fingers, and you're going to wash the back of your fingers. Fingertips and nails, you're going to wash between your fingers and your thumbs. You're going to wash your thumbs, and you're going to wash your wrists. You're going to do all of that amazing interlocking washing for a minimum of 20 to 30 seconds. When you feel like you've gotten a proper wash, rinse everything thoroughly under the sink. Once you're rinsed, grab disposable paper towels or a clean towel to turn the faucet off. Dry your hands completely. Paper towels go in the trash. That dirty towel now would go into that closed container with the rest of the laundry until it's time for laundry, and then get your 70% ethyl alcohol hand sanitizer And you're going to do all of that again with your hand sanitizer. So you're going to go through those same motions so that you really feel like you are achieving that ultimate cleansing of the hands, so that you can then start your whole process over again for setup for your next client that's coming in, which is a basic facial once again. So you've got to look at that information that you have, and you're going to have to go through that whole setup procedure again before your appointment comes. So that concludes your basic facial video, and time to move on to the next one.